Today we're going to be talking about the disease tuberculosis. We will talk about its taxonomy chart and its characteristics, the size and shape of a tuberculosis cell, the signs and symptoms of tuberculosis, how the disease is transmitted, the location of where tuberculosis occurs in, what population is at risk, current treatments that have developed, the history of tuberculosis, and finally, what future studies will scientists be experimenting with in the future. First, let's begin with each taxa, starting with kingdom and why they belong in this specific category. The kingdom of tuberculosis is prokaryotes. A characteristic of prokaryotes is that they lack a membrane-bound nucleus. Next, the phylum of tuberculosis is firmicutes. All firmicutes don't have a cell wall. Next, we have the actinobacteria class, where their cells can form spores. In the acene-mycetose order, the thin filaments or rods in this taxa can occur anywhere in the body. It's also part of the Mycobacterium genus because the bacteria can't move. This disease's species is tuberculosis because tuberculosis cells commonly affect the lungs. Tuberculosis cells are anywhere between 2 to 4 micrometers in length and between 0.2 to 0.5 micrometers in width. The tuberculosis cells are outward or slightly curved, bacillus shaped. Some signs and symptoms of active cases of tuberculosis includes tiredness, weakness, weight loss, fevers, coughing, chest pains, and loss of appetite.
It's like 103.
Tuberculosis is transmitted when an infected person either coughs, sneezes, or spits and a non-infected person has inhaled the contaminated air. There is also another way to get tuberculosis through unpasteurized milk, but this is very uncommon. Tuberculosis is mainly found in the upper part of the lungs called the lobes, but the tuberculosis cells can also be found in the lymph nodes, the genitourinary tract, the bone and joint sites, and the lining that covers the outside of the gastrointestinal tract. The populations with the higher risk of obtaining tuberculosis symptoms are the elderly, infants, people who live with others who have tuberculosis, poor homeless people, and people who have a weakened immune system because of HIV infections, diabetes, or AIDS. Radiation, discovered by Roentgen, is used to look at the process of tuberculosis and to map the severity of the disease. Chemotherapy, founded during World War II, had used sulfonamide and penicillin, but didn't have much success to it. Herman Vermeer, a tuberculosis-positive doctor, was advised by his own personal doctor to go out and get some fresh air. When he got back, he built a sanatorium where other positive patients could also receive clean air and nutrients without having to travel far away from their home.
Sometimes it hurts instead.
There are already 3 new vaccines for tuberculosis that are in the process of clinical trials. In future studies, scientists are hoping to speed up the process of diagnostic periods for tuberculosis patients. The Mycobacteriaceae family are grouped together because they all cause diseases in mammals.